Hello, I'm Dr. John Cruz. So today I'm going to be talking about confusion between borderline personality disorder and ADHD. Why is this going on and what's the problem? So the take-home message is that although borderline personality disorder, which we think of as a personality disorder and sort of the bias is that that's a social psychological condition that's present in maybe a late adolescence and adulthood, and ADD, which is a largely biologically driven process that develops in childhood, on the surface, they seem to be distinct problems. So, borderline personality, but there are strong connections between them, and they're also often the two of them are, each of them is confused for the other, and I'm going to talk about why and how to unconfuse them. So, borderline personality disorder, defined by the DSM-5, is a pervasive pattern of instability in interpersonal connections, relationships, in instability in self-image, and instability in emotional life. And to qualify, and I'll be going through these points in a little more detail, you have to have at least 5 of these 9 criteria. And again, they need to be pervasive over time. So you have to have, among them, chronic emptiness, emotional instability, frantic attempts at perceived or real abandonment, markedly unstable self-image, that's 4, impulsivity, particularly around money, sex, drugs, other things that are causing self-harm, excessive displays of anger, 6, unstable relationships, and particularly a pattern known as splitting, where the individual with borderline personality disorder switches between idealizing or thinking the person they're interacting with is wonderful and perfect, and then switching to devaluing, where they're the worst, horriblest, nastiest, not caring person in the world. Number 8 is suicidal actions or parasuicidal, so attempts at self-harm. And number 9 is paranoia or severe dissociation. And in fact, the term borderline personality disorder comes from, initially this was conceptualized as being on the borderline of psychotic behavior. So on the surface, that doesn't seem to have a lot to do with ADHD, which is, again, patterns arising at least before age of childhood years of inattention, distractibility, impulsivity, and hyperactivity. So why do these overlap or get confused is a good question. So a little bit more, our best or most frequently used conceptualization of how people develop a borderline personality disorder comes from Marsha Linehan, who developed a therapy called dialectical behavioral therapy, or DBT, for working with people with borderline personality disorder. And it combined cognitive behavioral skills training with a mindfulness, Zen-like radical acceptance approach, and has been demonstrated to be helpful for even the most severe suicidal ideation associated with and actions associated with borderline personality disorder. So her conceptualization is that people with borderline personality disorder have a biological tendency towards emotional volatility, so emotions that come up big and strong and are harder to control. And in combination with that, they grow up in a invalidating early childhood environment. So parents who deny that the kid's feeling the feelings they're having, or doesn't let them report their feelings, or invalidating to a greater extent. So there's many studies show a strong correlation between childhood abuse or severe neglect and development of borderline personality disorders, and abuse and neglect would be the extreme ends of invalidation. So we know, again, ADHD, maybe 5% of adults have it, borderline personality, only 1 or 2%, but in many studies, anywhere from 30 to 60% of people with a borderline personality disorder seem to fit full criteria for ADHD. In one Swedish study, which looked at the whole population who were born under a certain time span, looked at 2 million records of people. Among those with borderline personality, if you had ADHD, you were 19 times more likely to develop borderline personality disorder than if you didn't. That doesn't mean you have to have it. That doesn't mean everyone with ADHD develops borderline personality, but there is a strong correlation or tendency. And some of the studies suggest, again, rather than thinking of ADHD as a biological and biological only brain condition, and borderline personality disorder as a psychological, not biologically mediated condition, it's pretty clear that both nature and nurture have a role in both. There seem to be a host of many genes having a small effect, which can increase the likelihood of developing either borderline personality disorder or ADHD, and probably many of those genes are the same or in common, although not a lot has been directly studied in that regard. And if you're growing up in an ADD family, and again, often because of the strong genetic component, parents are ADHD, the childhood environment's more likely to be chaotic. There's more likely to be trauma and accidents. There's more likely to be parents missing communication or ignoring it because of their own ADD. So it's not hard to imagine why there may be a predisposition to an invalidating environment if you're growing up in an ADHD household. So I'm going to go through those 9 characteristics or traits, again, 5 of which are needed in a pervasive pattern, and show why there's so much overlap with ADHD. I'm going to say 1 or 2 points first. That frequently, certainly in the mental health field, borderline personality disorder is often considered the most pejorative diagnostic label. There have been many attempts by people who want to remove it completely, thinking it's imprecise. It doesn't really describe anyone other than the people or patients you don't like to work with. I would say that there does seem to be a core constellation of features which do accurately and helpfully describe a population of people. And interestingly, despite what a pejorative or loaded label it is, and an example of that, one person I started working with more than 25 years ago, and she has the list still, went to or contacted more than, or at least 57 different psychiatrists, therapists. She was in her 30s then, had a history of multiple hospitalizations, multiple cuttings, diagnosis of borderline personality disorder, 57 therapists and psychiatrists before she found one who was willing to work with her. So again, so despite the mental health field pejoratizing this label, interestingly, most of the individuals I've worked with who were not previously diagnosed, who the diagnostic label fit, were actually welcoming and appreciative of it, because again, this is a condition that embodies so much pain, so much alienation, so much confusion, so much confusion about self and who they are, and to have a label that accurately, or at least partially, describes what you're going through, and to know that other people are having similar experiences, and that there may even be treatment modalities that are helpful for mitigating some of that pain, can be tremendously powerful. So again, many therapists, and I know mental health, are very reluctant to offer this as a diagnosis, but I'd say if it's present, it's often a benefit to the patient to receive this information. So I think the big reason for the confusion overlap between ADHD and borderline personality disorder are 2 of the 9 traits, and one is the emotional instability, and the other is impulsivity, and I'll be getting to those later. I'm going to run through the others though. So on the surface, one of those 9 points was suicidality and self-harm. On the surface, what does that have to do with ADHD? Lots of people with ADHD are happier, even happier or more oblivious than normal. We know, though, that ADHD is at least as big a risk factor statistically for suicidality as is depression. Um, Again, ADHD on average cuts about 10 years off of a kid's life, and that's about the same extent that depression cuts off of someone's life or diabetes. And at least half of the deaths, roughly speaking, half of the excess mortality from ADHD is from suicide, the other half is from accidents. So again, even though on the surface suicidality is not a criteria for ADHD, a lot of people with ADHD are never suicidal. Way too many wind up there, and often with lethal consequences. So that's, again, an area of partial overlap. One of the other 9 points was frantic avoidance of abandonment or perceived abandonment. And again, this doesn't on the surface fit with ADHD at all, although you can see shading into on a spectrum, rejection sensitivity is a commonly observed phenomena in ADHD. And again, rejection sensitivity isn't the same as fear of abandonment, but they're not completely alien from each other. Again, they clearly have some relationship between the two of them. A sense of chronic emptiness. So I'm starting with those that seem least connected to the ADHD. So chronic emptiness, again, is a characteristic of ADHD. A characteristic of borderline personality disorder, where people who have it often don't even feel like a person. They feel like disconnected set of different emotions, intense emotions at different times with no continuity, no sense of who they are, and a sense that inside they really aren't a real person, a valid person, certainly not a good and decent member of human society. There's certainly people with ADHD who have negative self-images. It's less often that that's pervasive emptiness is there, but that again blurs into the next point. So point 4 among the borderline criteria is a markedly unstable self-image. And again, many people with borderline personality disorder they can agree that historically, yes, they knew a person who was doing this in 9th grade and tried to do this in college or X, Y, or Z, but there doesn't feel to them like any inner sense of continuity, inner sense of sameness. How they feel one day may be completely separate. And there, I think, again, there is some mild overlap with people with intense ADHD. If their intention is so focused in one moment or hyper focused, and they're so distracted that it can feel like what I was doing to, what did I eat for breakfast? Don't have a clue. So there can be a less severe, maybe more superficial and event related instability of self-history, self-image, but again, it tends to be a much more deep and pervasive issue with borderline personality disorder. Next point or characteristic of borderline personality disorder is unstable relationships. Again, that switching between or splitting phenomena, making someone either the idealized perfect person or the horrible worst person in the world. And again, to that extent or level, that's characteristic of borderline personality disorder. But we know just statistically, people with ADHD do have more unstable, do have relationships that tend to be of shorter duration. They report less satisfaction in the relationships, so there's higher rates of divorce, lower rates of marriage, lower rates of a lot of objective measures of pairing up or forming relationships in ADHD. So again, some overlap. And then the last, not the last, so 2 more points. One is the paranoia and severe dissociation that are characteristic, again, of borderline personality disorder. And that, again, may seem on the surface, what's that have to do with ADHD? But one of our previous talks, we talked about how, so with I would say with borderline personality disorder, the paranoia tends to be pervasive and tied to a sense that nobody is trustworthy, no one's really going to help me, no one really understands me, nobody really likes me. With the paranoia that can show up with ADHD, and again is more common in those with ADHD than the general population, I think more of it happens from inattentiveness leading to missing pieces of communication, maybe impulsiveness and blurting things out, and damage to relationships where then you don't know why the other person's behaving the way they do because you didn't understand your behavior in the same context they did. So again, paranoia is not completely removed from the realm of ADD behavior. Severe dissociation, though, is not at all a feature of ADD. Um, so the last so there's 3 points so of the ADD or the borderline characteristics that again are that I think are lead to the main confusion. I'll include excessive anger, emotional instability. I'm going to lump those two together even though they're considered separate, and impulsive behavior. So emotional instability is not officially in the DSM criteria for ADHD. There are many ADHD experts who think it should be. So again, the ADD criteria officially focus, I'd say, excessively on the cognitive domain rather than the emotional domain. But if you're viewing ADHD as a problem of executive functions or controlling how your brain processes information, it wouldn't be surprising that not only cognitive data-driven information, but emotional feeling states also may be poorly regulated. And particularly people with hyperactive forms of ADHD, in every study I'm aware of, a majority, 2/3, 3/4, have substantial emotional instability. And particularly because that is not in the official DSM criteria, and particularly because in children and others, we focus so much on ADHD problems with schooling and with job performance. And again, the cognitive performance aspects, we minimize the presence. So if someone is seen being emotionally unstable, again, it may well be part of their ADD, but a therapist or a clinician who's not that aware that emotional instability can be part of ADHD jumps around and looks for other causes. Again, I've talked about some blame it on, oh, this must be bipolar disorder because they're having different mood states, or they must be borderline because they're showing such strong emotions and such poor ability to regulate them. So that's, and so with one of the features that's a little different, I would argue, is that the emotion itself that gets displayed so often and excessively in borderline individuals is anger. It's the lashing out, either verbally, physically, or engaging in acts that sabotage or harm others that seems excessive by societal standards. So excessive rage. And again, people with ADHD frequently are people who have road rage or other, again, impulsive reactions. The experts who try, so what I would say is either group can have excessive strong emotions other than anger, but with ADHD, you tend to see a much broader range of excesses. So particularly joy. If someone finds a dollar on the street, they may be jumping up and down, or they see a friend they haven't seen for 2 days, they may be overly embracing, or again, the range of emotions that are overly expressed in those who have that as a feature of their ADD tends to be a broader range of joy, sadness, anger, fear, what's ever going on. With borderline personality disorder, there seems to be a strong preponderance of anger being among those feelings, including, again, when they're sad or rejected or feeling other feelings. Often what's getting expressed is the anger. So the other, again, big overlap is impulsivity. And the difference here is that with, again, ADHD, it's a broader range of impulsive behaviors. Many people who tried to parse it out um, connect the impulsivity with hyperactivity, and that the person actually has more trouble stopping once they've started engagement in something because the momentum of it keeps them going on, and that the um, so describing it as motor driven, harder to interrupt once it's going on, and the claim is that those with, in contrast, borderline personality disorder, the impulsivity is often stress dependent. So the person's feeling rejected or feeling they're going to be abandoned or feeling they're being attacked. And then they lash out in either an attacking way or a self-destructive way. And again, the impulsivity with borderline personality disorder emphasizes self-damaging behaviors such as excessive drinking or cutting themselves or sex, engaging in risky, dangerous sex or drugs. Again, all those are things that people with ADHD can do. But with ADHD, they're not necessarily doing it only out of a stressful situation. They're doing it sort of more spontaneously. And maybe for me, a way I formulate it again is sort of getting at the underlying motivation. The impulsivity with ADHD is often joy or reward, or this looks like fun, I'm just going to do it without considering the consequences. With borderline personality disorder, it's often fear/anger related, that they're impulsive in response to those intense emotions. So those are some of the information on, again, the reason there's a whole lot of overlap. And I, again, tried to explain how one can try to differentiate some of the emotional instability and impulsivity between those two conditions. There has not been an extensive amount of research on how do you treat the two conditions when they're together. My own experience with individuals is if they have both borderline personality disorder and ADHD, that DBT is a powerful tool for at least helping with some of the emotional instability, and may well help, again, because there is an extensive record of cognitive behavioral therapy being helpful with ADHD. So there are, again, talking therapies can address both. There's a little bit of data looking at the emotional impulsivity of ADHD or emotional instability, and that Ritalin, maybe other stimulants as well, can help with that. To my knowledge, there are no studies of, in the context of borderline personality, do stimulants also help stabilize emotions. So I've been talking probably long enough. I hope the connectivity is good because I keep seeing flashing in the background on my screen. I do see some questions, so I'm going to read them. So the first person, Roger, thanks for your comment, and he's talking about how invalidation and neglect and can contribute to having a diagnosis of borderline personality disorder. And Rodolfo is asking whether emotional dysregulation is an official DSM diagnosis. So emotional dysregulation is not an official diagnosis. It's included, again, in part of the symptoms, or one of the 9 symptoms of borderline personality disorder. It's also a characteristic of manic states, but it is in and of itself, it's not an official diagnosis, and I don't believe it's a diagnosis in the ICD-10 either. So I hope that addressed that point. I'm not seeing any other questions coming in. I'm putting together a February schedule, so I don't have it yet. Somewhere in February, I will be talking about ketosis. We talked about intermittent fasting. I'm not sure whether it will be next week. I'll probably also be talking about chocolate sometime in February. So stay healthy, stay happy, and have a good week. Thanks for listening, and thanks for the good questions.